Hello, this is Dr. James Camp at Lee College in Baytown, Texas, and this is my introduction to the muscles of the body. Today we're going to be talking about how the name of a muscle can be linked with its action, its appearance, or its location. We're going to talk about the terms origin, insertion, and action, and the terms prime mover or agonist, antagonist, synergist, and fixator. Okay, so uh, very few of you may be old enough to remember a song, 50 Ways to Leave Your Lover by Paul Simon. Well, there are 7 ways to name a muscle. Um, 3 of them I consider fairly useful. Um, by functional anatomy, you can name uh, a muscle by its body region, and that helps you locate the muscle. So if I look at a muscle called the biceps brachii, and I recall that the brachial region is in the arm, then I know that that muscle is going to be up here in the patient's upper arm somewhere. Okay. Um, you can name something by its muscle attachment points. Okay. So this is looking a little more like um, the way we name joints as using part of the bones that they attach to name them. So a zygomaticus major is going to tell us that if we look at the skull, and I'm horrible at drawing uh, skulls, okay, this is looking more like a baby skull here, um, that we have that cheekbone zygomaticus here. Um, so our muscle in this case is going to be somewhere linked to that zygomatic bone. Okay. Um, muscle actions. Here we need to understand our body movements, but if we know that flexor carpi radialis, okay, we're going to take the carpals, that's here, and we're going to flex them. That means we're going to pull in this direction, so that muscle has to be up here somewhere. Okay, so these can all help us locate a muscle, help us make a link in our mind between where a muscle is and what the muscle does. Um, there are also 4 ways to name a muscle that have been historically used that I consider a little less helpful, in that if we know that a muscle has 3 heads, and that's literally what triceps means. Remember, cephalo means head. So triceps means there are 3 heads to this muscle. We can look all over the body and find multiple muscles or groups of muscles that appear to have 3 heads. So that doesn't help us until we see that it's linked to the word brachii. Um, muscle fiber orientation, um, we have the word rectus. Um, okay, if we have a muscle that goes in the same direction as the general body axis, okay, that's called a rectus muscle. If it goes um, opposite to that, it would be called a transversus muscle. And then there are muscles that have angles to them called oblique muscles. Okay. Um, again, that doesn't help us find the muscle because we can find all sorts of muscles all over the body that have rectus or transversus or oblique shapes. We just have to remember what part of the body that is in. Uh, perhaps the most ridiculous way of naming a muscle is its overall shape. Um, and I say ridiculous, it's once you see the muscle, it's sometimes quite easy to remember that was the shape that the person had in mind. Um, but a lot of times these shapes are pretty approximate. So trapezius should put you in mind of a shape you learned in geometry class called a trapezoid. But the muscle itself actually folds over the shoulder, so it looks kind of like that. When you look at it from the back, it doesn't really look all that trapezoid-like unless you really use your imagination. There are other muscles. There's a pair of muscles that together looks like this that are called rhomboids. That the shape that is like a square but slanted is called a rhombus. So we take the us away and make it a rhomboid. Now, don't ask me why trapezius became, why a shape called a trapezoid became a trapezius, but a shape called a rhombus became a rhomboid. None of this makes a whole lot of sense, and so a lot of these you unfortunately just have to memorize. There are muscles that have a jagged edge. That didn't work out very well. Let's try that again. There are muscles that have a jagged edge, like the serrated edge of a knife, and so we call those serratus muscles. There are muscles that have a sort of vaguely tubular shape to them, and that in Latin is teres. Okay, so we have a lot of muscles that are named after their overall shape, and in most of those cases you just kind of have to memorize where the muscle is, but when you look at it, maybe the shape will suggest. Another one, if I showed you this shape, you would probably think triangle. Triangulus? Is there a muscle called triangulus? No. This one is the Greek letter delta. That's a capital letter delta. That's what a capital D looks like in the Greek language. And so delta became deltoid. And so there's a triangular muscle in your shoulder called the deltoid muscle. So sometimes the shapes aren't even named after shapes. They're named after letters of the Greek alphabet. Finally, there's the relative size of a muscle. If we have one huge muscle in the pectoral region and one small muscle in the pectoral region, one of them is going to be called major and the other is going to be called minor. Okay, so let's look at a few examples of these real quick. There are a lot of body regions that are used in muscle names. The first most useful category for figuring out where a muscle is. So you'll remember that oral refers to the mouth, so the orbicularis oris we know is somewhere around the mouth. Cervix refers to the neck. Brachii refers to the arm. Carpi to the carpals, the wrist. Pollicis. Now here you got to be careful though. The flexor carpi muscle is not on the wrist, it flexes the wrist. And the opponent's pollicis muscle is not on the pollex, the thumb, it moves the thumb. So these are actually located a little further up on the forearm. The gluteus medius, the quadratus femoris, gluteal region, femoral region. We had a pollex up here, we have a hallux down here. The tibialis, there are two muscles that hug the tibia, an anterior and a posterior. Latissimus dorsi is going to be, uses two different positional words. Lateral, for, latissimus for lateral, dorsi for dorsal. So we know that position of that muscle is lateral and dorsal. It's on the lateral side of the person's back. And then some, it's not naming a particular body region, but posterior, superior. So we're using our body anatomical terms here. Okay. Muscle attachments, the ones that I said are kind of like our joint names. The most joint-like name is the sternocleidomastoid. It hits the sternum, the clavicle, which somehow becomes cleido in this case, and the mastoid process of the temporal bone, and so we put those three together and we get sternocleidomastoid, which is one of my favorite muscle names. Intercostal, going to be between the ribs. Subscapularis, okay, that's going to be in the subscapular fossa of the scapula. Okay. Now you have to be careful that subscapularis could mean below the scapula, and a lot of people look somewhere on the back below the scapula for this muscle, but that's not what it is. It's talking about the subscapular fossa. Fibularis longus and brevis, zygomaticus major and minor. Okay. Muscle actions. If you're familiar with the actions of the body, these can help you find a muscle by thinking about where it would have to be to do its job. So an adductor would have to be located on the inside of a body part to be able to adduct that body part. So adductor magnus and adductor pollicis longus, or adductor magnus and brevis and such, are located on the inside of the thigh. Abductor pollicis longus, okay, that's going to be somewhere out here to abduct the thumb. Flexor carpi radialis, going to be on the underside of, or the anterior side of the arm to cause this flexing motion of the wrist. Okay. Then we get to the four that I said were a little less useful. Biceps, triceps, and quadriceps mean 2, 3, and 4 heads. And just to be tricky, sometimes they refer to an individual muscle, as in biceps femoris and triceps brachii. Sometimes they refer to a whole group of muscles, as in quadriceps femoris or triceps surae, the 3 heads of the calf muscle. Fiber direction, rectus means straight up and down. The obliques, there are 2 of them. There's an external oblique that comes down from the armpit and an internal oblique that comes up from the hip. Orbicularis means circular, so we've got orbicularis oculi and orbicularis oris. Overall shape, here's that trapezius I was talking about, which, for all the world does not look much like a trapezoid when you see it displayed on the human body. Deltoid, we mentioned here. Is going to be this triangular muscle there. Pronator quadratus is going to be a quadrilateral. And then they lump in here the longus and brevis. I would consider that more the relative size category. So here's that relative size category. We've got pectoralis major and minor. This one is major. The minor one is kind of located under the pectoralis major, and it looks about like this. We have zygomaticus major that goes down to the lips, and minor that kind of goes over to the nose. When you have 2, as in the fibularis muscles, that are different lengths as opposed to different sizes, there's sometimes a longus and a brevis for long and brief. Sometimes you have 3 muscles that cover the same area that you want to give similar names to. So in this case, we used gluteus maximus, medius, and minimus. or as I like to say, maximus, medius, minimus. Okay. Um, and then for the abductor or adductor, for the adductor muscles of the thigh, we have a longus, a brevis, and a magnus. So you can imagine magnus is just gigantic. Okay, so those are the ways we name a muscle. Now let's talk about a couple more classification bits before I let you go. The first is origin, insertion, and action, which sounds like it ought to be one of those things they say on a movie set. Origin, insertion, action! The origin points of a muscle are the stable attachment points. So every muscle has two attachment points. Okay, it has a stable attachment point, one that isn't going anywhere when the muscle does its job, and those are called an origin or origin points. This is a biceps muscle, two heads, so it has two origins. Then there is a moving attachment point of the muscle, which is called its insertion. Okay, and the idea is that when the muscle contracts, where muscles do one thing, I'll say this over and over in my muscle videos, muscles do one thing, and that is contract. They make themselves get shorter. And as this muscle gets shorter, the origin isn't moving, so the insertion is going to be pulled toward the origin. And that's going to cause, in this case, a flexion movement. And that movement is called the action of the muscle. Okay, and our actions are described using those body movement terms we learned in the last part of the skeletal unit, where we talked about movement, or the last part of the joints chapter, where we talked about the movements of body parts. So we have muscles that flex, muscles that extend, muscles that abduct or adduct, muscles that rotate. So those are important. One thing that's worth noting here is that when we describe a muscle action, we use sort of a regular English or anatomical English. So instead of saying that we're flexing the antebrachium at the humero-ulnar joint, we're going to say here that we flex the forearm, which is the anatomical English word for this part of the body, right, at the elbow. And that is the full description of what this motion is flexing the forearm at the elbow. A lot of textbooks will drop one or the other pieces. They'll just say flex the forearm or flex the elbow, because in most cases there's only one movement possible, one body part that could move in that case. If you're flexing the forearm, you know you're moving the elbow. If you flex the elbow, you know you're moving the forearm. One last note, some muscles can act in reverse on occasion. We call this a reverse muscle action, or RMA. And these are most important when it comes to breathing motions. A lot of the muscles, like the sternocleidomastoid and the pectoralis minor, have movements of the body that are their primary job, but they can act in reverse to help expand your rib cage. So they can pull on their origin points. Normally the origin point doesn't move, but they can make their origin points move to expand your rib cage and make it easier to take a deep breath. Okay, so at this point, you're going to look on Dragnet. You're going to find each major muscle of the body axis or the body appendages, and you're going to sort of stick each label. Okay, as you do that, we're going to provide you a sheet with a place to record the action, origin, and insertion points, and I want you to look up those actions, insertions, and origins and record them on your sheet. This is going to come in handy later when we do our activity muscles in motion or muscles in action, I forget what I called it. Okay, one last thing. Muscles have different roles in body movements. So when we get to the part where we're going to talk about actually which muscles make a particular motion happen, so far we've discussed the idea as if there's one muscle that moves. So here we see this person doing leg lifts on their side, and we've highlighted a single muscle. It might be the tensor fasciae latae that we're highlighting there, as if that muscle is doing all the work. But in reality, that body movement involves multiple muscles. There are 4 roles a muscle can play in a body movement. The primary role is called agonist or prime mover. Okay, you'll see prime mover used a little more than agonist because agonist just sounds weird. In literal Latin, agonist means the thing that makes something happen, but the way it's moved into modern English, we think agony means pain, right? And the agonist is not the muscle that causes you pain. So the plain English prime mover is often used instead. For every action, there's an opposite reaction. So if you're going to flex the muscle, there has to be a muscle that's capable of unflexing or extending the muscle, and that would be your triceps muscle. Okay, we call that the antagonist because if it were to contract at the same time as the agonist, it would cause the opposite movement, and the muscles would fight each other, and you can imagine the body part just sort of vibrating back and forth between trying to flex and trying to extend. So what actually has to happen in the body, and the brain knows this and sends all the appropriate signals, is that at the same moment that the agonist or prime mover starts to contract, the antagonist has to initiate a movement of relaxation, of elongation. Okay. Sometimes there are other muscles. For example, the brachioradialis muscle looks kind of like this on the arm that help the agonist move the body part, and those muscles are called synergist. And when we do our muscles in motion activity, I'm going to ask you to name not just an agonist or a prime mover, but also a synergist that helps the body part move. So in this case, we might list if the biceps brachii is the prime mover, the brachialis muscle, which lies right here, or the brachioradialis muscle, which lies right here, those might be synergist muscles. Finally, there are muscles that overlie the fixed point, the origin point, that stabilize those other joints while this movement occurs. So we want motion at this joint, but if you look at where the origins of the biceps brachii muscle are, they lie up over this joint. So what we would really do is every time we tried to lift a weight, lift a grocery bag, lift a weight in the gym, anything like that, is that this motion would happen too. We'd end up throwing that grocery bag over our head. We don't want that. So we have muscles in here that stabilize the shoulder joint that hold it in place. And those muscles are called fixator muscles. Okay, so for the example of forearm flexion, we can see here the biceps brachii is the agonist or prime mover. The triceps brachii would be the antagonist because it produces the opposite motion on the back of the arm. And the brachioradialis and the brachialis are acting as synergist muscles. I'll leave it to you to think about what muscles might be, because they're not drawn on this figure, what muscles might be fixators that that keep the forearm from, keep the shoulder from flipping up at the same time that we're flexing the forearm. Okay, so that's it for names and terminology of muscles and their movements. I now leave you to a couple of excellent videos from Dr. Ross on walking you through the names of the individual muscles of the body and all those Dragnet activities and things for you to do there. Okay, thank you very much.